Welcome to the deep dive. Today we're going way back to the basics with Phenoxypenicillins.
Ah, yes, the good old penicillins.
We'll be using Kuser's The Use of Antibiotics, 6th edition, as our guide for this deep dive.
A classic.
It came out in 2010.
Oh, wow, 2010.
I know what you're thinking. Isn't that a bit old?
Well, yeah, things move so fast in medicine.
But sometimes, going back to the fundamentals could be super helpful. Gives us a really solid understanding. So think of this as a deep dive into those core concepts of Phenoxypenicillins.
A great way to put it. Kuser's is a classic for a reason. It lays out the groundwork so well.
Absolutely. So let's start with the basics. What exactly are Phenoxypenicillins and what makes them stand out in the world of antibiotics?
Well, Phenoxypenicillins are part of the penicillin family. Obviously, penicillins were a huge deal in medicine.
Like a total game changer.
What sets Phenoxypenicillins apart is that you can take them orally.
Oh, so no needles.
Yeah. They're like the easier-to-take cousin of penicillin G, which you have to give intravenously or intramuscularly.
So much more convenient for patients.
Definitely.
But how do they survive that trip through the stomach? I mean, stomach acid is pretty tough on a lot of medications.
You're right. Stomach acid can really break down a lot of drugs. But Phenoxypenicillins, they have this neat little chemical trick.
Oh.
They have this special group added to their structure called a phenoxymethyl group.
Okay.
And this little addition makes them much more stable in acidic environments.
So they can handle the stomach acid and still get absorbed into the bloodstream.
That's likely.
That's pretty ingenious.
It really is. This simple change basically opened up a whole new way to use penicillin, making treatment much easier for so many people.
Amazing. So we know they can be taken by mouth. That's a big plus. But how effective are they? What kind of bacteria can Phenoxypenicillins actually fight off?
So they mostly target gram-positive bacteria.
Gram-positive?
Yeah. For those who aren't microbiologists, gram-positive bacteria, they're a big group of bacteria with a specific structure to their cell walls, and that makes them vulnerable to certain types of antibiotics, like penicillins.
Ah, so they're kind of like specialists, these Phenoxypenicillins.
Exactly. And some of the big ones they target are Streptococcus pyogenes, which causes strep throat, Streptococcus pneumonia, often the cause of pneumonia, and then some strains of Staphylococcus aureus, a bacteria that can cause a whole bunch of different infections.
So they're going after some of the most common infections that people experience.
You got it. And that's what makes them so useful in clinical practice. They're often the first choice for mild to moderate infections like, skin infections, ear infections, and sore throats.
Okay, so now for the part I always find fascinating. How do these Phenoxypenicillins actually work? How do they kill the bacteria?
All right, so all penicillins, and that includes Phenoxypenicillins, they interfere with a really crucial process for bacteria cell wall synthesis.
So bacteria have cell walls that protect them, and penicillins mess with that process.
Right.
But how does that actually work?
Imagine a construction crew trying to build a brick wall, but someone keeps stealing their mortar. The bricks can't stay together, right? The wall crumbles. That's essentially what penicillins do to bacteria.
They sabotage the construction.
Exactly. They block an enzyme called transpeptidase. It's essential for cross-linking the peptidoglycan layer, which makes up the bacterial cell wall. That peptidoglycan, it's like the mortar holding everything together.
So they weaken the cell wall, and what happens then?
Well, without a strong cell wall, the bacteria can't withstand the pressure inside. They basically burst open and die.
A microscopic battle with some pretty dramatic results.
That's a good way to put it.
Now, let's talk about how these medications are taken. We know they come in pill form, but what's the typical dose, and how often do people need to take them?
Okay, so Phenoxypenicillins, you can find them as capsules, tablets, and even as a liquid syrup for kids who might have trouble swallowing pills.
Good thinking.
The usual dose for adults is somewhere between 250 to 500 milligrams every 6 hours.
Every 6 hours. That seems like a lot.
It's all about maintaining a steady level of the drug in your system. Think of it like a constant battle against those bacteria. You need enough soldiers on the front lines to keep those invaders at bay.
Makes sense.
And of course, the exact dose and how often you take it, it really depends on the type and severity of the infection. That's where a doctor's guidance is really important.
Of course, always follow your doctor's instructions. Speaking of doctors, I know they often talk about pharmacokinetics and pharmacodynamics. Those words always sound a bit intimidating to me.
Yeah.
Can you break those down for us?
Sure, I can demystify them a bit. So pharmacokinetics is basically the journey of a drug through the body. It's about how the body absorbs it, distributes it to different tissues, breaks it down or metabolizes it, and then finally gets rid of it.
So, tracking the drug's adventure from start to finish.
Exactly. Pharmacodynamics is more about what the drug does to the body, especially how it interacts with its target. In this case, it's about how phenoxypenicillin interacts with bacteria to stop them from building their cell walls.
Okay, so pharmacokinetics is the journey. Pharmacodynamics is the battle.
I like that.
Let's focus on the journey for a moment. What happens to phenoxypenicillins once they get into the bloodstream?
Well, they act fast. Phenoxypenicillins are absorbed pretty quickly from the gut, and they usually reach their highest concentration in the blood within an hour.
Wow, that's fast.
And what's really impressive is that they can reach different tissues throughout the body, like the lungs and even the fluid in the middle ear. That's why they work so well for respiratory infections like pneumonia and ear infections like otitis media.
So they're efficient at getting where they need to go.
And then once they've done their job, they're mostly excreted unchanged in the urine. They leave the body relatively quickly.
Very efficient. But like all good things, I imagine there's a potential downside. Are there any side effects to watch out for with phenoxypenicillins?
You're right. Every drug has potential side effects. With these, the most common ones are, well, they're gastrointestinal issues.
Like what?
Like diarrhea, nausea, vomiting. Usually they're mild and tend to go away on their own.
Not fun, but manageable.
Yeah. But the big one, as with all penicillins, is the risk of allergic reactions.
Right. And those can range from mild to severe, I imagine.
Exactly. They can be anything from mild skin rashes to a very serious reaction called anaphylaxis, which can even be life-threatening.
Anaphylaxis sounds scary. What happens during that kind of reaction?
It's basically your immune system overreacting. It can involve a sudden drop in blood pressure, trouble breathing, and swelling of the face, lips, and throat. It's a medical emergency.
So not something to take lightly.
Definitely not. If you experience any signs of an allergic reaction after taking a penicillin, seek immediate medical attention.
Absolutely. Always better to be safe than sorry.
And it's important to tell your doctor about any history of penicillin allergy before they prescribe it.
Makes sense. So to wrap up this part of our deep dive, let's talk about when phenoxypenicillins are the go-to treatment.
Okay, so phenoxypenicillins are often the first choice for those common mild to moderate infections we were talking about earlier. Skin infections like impetigo, ear infections, especially otitis media in kids, and strep throat. They're also used to prevent rheumatic fever, a serious complication that can happen if strep throat isn't treated.
So they're a really useful tool for dealing with everyday infections.
Absolutely. They've been a mainstay of antibiotic treatment for decades, and even with the rise of antibiotic resistance, they still play a crucial role.
It's amazing how something as seemingly simple as an oral penicillin can have such a big impact on our health.
It really is. But as you mentioned, antibiotic resistance is a growing concern. How has that impacted the use of phenoxypenicillins?
Yeah, that's an important question, and that's what we'll be exploring in the next part of our deep dive.
Stay tuned! Things are about to get even more interesting as we dig into the challenges and the future of these essential antibiotics.
Can't wait. See you next time.
Welcome back to the deep dive.
So we've been talking about phenoxypenicillins.
Yes.
And how they've been around for decades.
They're truly a classic in the world of antibiotics.
But like we mentioned in the last part,
Yeah.
the world of bacteria, it's always changing.
Bacteria are incredibly adaptable. They're always finding ways to survive.
Right, and that brings us to a big challenge. Antibiotic resistance.
It's a serious issue. We can't ignore it.
Our source material, Kusers, it's from 2010, and a lot has changed since then.
Oh, absolutely. Antibiotic resistance has become so much more widespread and complex.
So how has this affected phenoxypenicillins? Are they still as effective as they used to be?
That's the big question.
Right.
And while they're still a valuable tool, their effectiveness has been impacted.
In what way? Can you give us some specific examples, like which bacteria have become particularly resistant to phenoxypenicillins?
Well, one of the most notable examples is Streptococcus pneumonia.
The one that causes pneumonia.
That's the one. Some strains have developed these modified penicillin-binding proteins.
Those are the targets that phenoxypenicillins attack, right? The ones that disrupt cell wall construction.
Exactly. The bacteria have basically changed their locks, making it much harder for the phenoxypenicillins to get in and do their job.
So it's like the bacteria built up this defense mechanism.
A very effective one, unfortunately.
Right.
This resistance has become a real concern, especially for infections like pneumonia and otitis media.
That's worrying. So what can we do about it? Are we losing the battle against these resistant bacteria?
Not at all. Scientists and researchers are always working on new strategies.
That's good to hear.
Absolutely.
What are some of the approaches being explored?
One approach is combination therapy.
So instead of using phenoxypenicillins alone, We combine them with other drugs.
Exactly. For example, combining them with a beta-lactamase inhibitor can be very effective.
Okay, can you explain what a beta-lactamase inhibitor is?
Sure, think of them as protectors. So some bacteria produce these enzymes called beta-lactamases.
Enzymes are like those tiny machines that speed up chemical reactions, right?
That's a good way to think about it. And beta-lactamases, their job is to break down beta-lactam antibiotics.
Which makes the antibiotics useless.
Exactly. It's like the bacteria's weapon against penicillins.
So how do the inhibitors work?
Well, scientists have developed these beta-lactamase inhibitors that essentially shield the Phenoxypenicillins, allowing them to do their job of disrupting cell wall synthesis.
So the phenoxypenicillin and the inhibitor work together as a team to overcome the resistance.
Precisely. This combination therapy has been quite successful in treating infections caused by bacteria that have become resistant to phenoxypenicillins alone.
That's good news. Are there any other strategies being researched?
Definitely. The search for new antibiotics is ongoing.
So scientists are trying to create entirely new drugs that can overcome this resistance.
Yes, they're always looking for new ways to target bacteria.
What about alternative approaches? I've heard about things like phage therapy.
That's a really interesting area of research. Phages are these viruses that infect and kill bacteria.
So we're using viruses to fight bacteria.
It's pretty fascinating. We're harnessing nature's own tools.
It sounds a bit like science fiction.
It might, but it's becoming more and more real. Phage therapy has the potential to be a huge help in the fight against antibiotic resistance.
It's incredible how innovative scientists are, how much the field of medicine is constantly evolving.
It really is amazing. It shows our determination to overcome these challenges.
But while we're waiting for new treatments, is there anything we can do now to help combat resistance?
Oh, absolutely. Responsible antibiotic use is crucial.
What does that mean exactly?
It means only taking antibiotics when you really need them, like when a doctor prescribes them.
So no self-medicating or asking for antibiotics for a virus.
Exactly. And it's also important to finish the entire course of antibiotics, even if you start to feel better.
Why is that so important?
Well, if you stop taking them early, you might not kill all the bacteria, and the ones that survive can become resistant.
So we could be contributing to the problem without realizing it.
That's right. And basic hygiene practices, like washing your hands often, can go a long way in preventing the spread of infection in the first place.
So it's about being proactive and responsible.
Absolutely.
This deep dive into the world of phenoxypenicillins has been really eye-opening. We've gone from the basics, like their structure and how they work, all the way to these complex challenges like antibiotic resistance.
It's been quite a journey.
It has. But before we wrap things up, I have one more question for you.
Go ahead.
We've talked about the past and the present, but what about the future? What do you think the future holds for phenoxypenicillins in a world where resistance is becoming such a huge problem?
That's a great question. And it's tough to say for sure. The future of any antibiotic is uncertain, especially when you're dealing with resistance.
So it's hard to predict what will happen.
It really is. But I do think that phenoxypenicillins will still have a place, even if that place changes over time.
How do you think their role might change?
Well, we might see them being used in a more targeted way, only for specific infections where we know they're still effective.
So a more strategic approach.
Exactly. And we might need to rely more on those combination therapies to overcome the resistance.
Pairing them with other drugs.
Yes, to make them more effective. The key is going to be using them carefully and continuing to research new approaches.
It sounds like the future of phenoxypenicillins, and all antibiotics for that matter, depends on this multi-pronged approach.
I think you're right. We need a combination of careful use, new research, and a collective effort to really address what causes resistance in the first place.
It's definitely a complex issue.
It is.
Well, this has been a fascinating discussion. I feel like we've only just scratched the surface, but I hope this deep dive has given our listeners a better understanding of phenoxypenicillins, what makes them so effective, and what challenges they face, especially in a world where antibiotic resistance is becoming such a concern.
It's been a pleasure exploring this topic with you.
And now we're going to take a short break, and when we come back, we'll wrap up this deep dive with some final thoughts on the bigger picture of antibiotic resistance, what it means for all of us.
Welcome back to the deep dive. We've spent the last 2 parts really digging into the details of phenoxypenicillins, their structure, how they actually work, and then even the challenges they face with this whole antibiotic resistance thing.
It's been quite a journey, hasn't it, through the world of bacteria and the drugs we use to fight them.
It really has. And as we've been talking, I've been thinking about the bigger picture. We focused a lot on the science. But what about the human impact? Like, how have these oral penicillins actually changed people's lives? That's such an important point. It's easy to forget when we're so focused on the molecular level. The development of phenoxypenicillins was a huge turning point in medicine.
I can imagine, yeah, before oral penicillins treatment meant injections, which are, well, not the most pleasant experience.
Exactly. Think about it. No one really likes getting a shot, especially children. Phenoxypenicillins made treatment so much easier, more accessible for everyone.
I bet parents everywhere were thrilled when these pills became available.
Oh, absolutely. It completely changed how we treat common infections and had a real impact on public health. Phenoxypenicillins have helped prevent those serious complications from everyday infections, which has meant a better quality of life for so many people.
It is kind of easy to take antibiotics for granted these days,
It is.
but their impact has been huge.
They've saved so many lives, and they continue to do so. But, as we've been talking about this antibiotic resistance, it is a serious threat, a reminder that we need to be careful, be responsible with these medications.
So what does that look like, this responsible stewardship? What can people do?
Well, it means using antibiotics only when they're truly needed. And when they are prescribed, making sure you complete the entire course as directed, and not pressuring doctors for antibiotics when they're not appropriate, like for viral infections.
So it's really a partnership between doctors and patients.
Exactly. Doctors need to be careful about when they prescribe antibiotics, and patients need to follow their instructions carefully. And then on a larger scale, we need continued research to develop new antibiotics and other treatment options.
So a multifaceted approach is needed to tackle this.
Absolutely. It requires scientists, healthcare professionals, policymakers, and the public all working together. We all have a role to play.
Our deep dive into phenoxypenicillins has really shown just how powerful scientific discovery can be, and also the ongoing challenges we have in this fight against infectious diseases.
It's a story of innovation, of perseverance, and this constant search for better treatments.
And it's a story that's still being written, for sure. As we learn more, adapt our strategies, we can hopefully make sure that these life-saving medications stay effective for a long time to come.
I completely agree. The future of antibiotics really depends on all of us, understanding them, respecting their power, and protecting their effectiveness.
This deep dive has given us all a lot to think about. It's a reminder that even though these medications seem so ordinary, there's a whole world behind them. From how they work at a molecular level to the impact they have on our lives and the challenges they face.
It has been a fascinating exploration.
It has. And I hope our listeners have come away with a new appreciation for these amazing drugs. We've only scratched the surface, but hopefully this has made you a little more curious to learn even more. Knowledge is power, right? The more we understand about antibiotics, the better we can use them wisely and make sure they're around for the future. Thanks for joining us on this deep dive into the world of phenoxypenicillins. Until next time, stay curious.